Here we're going to look at some x-rays and some other factors, because I want to show you the significance of dynamic versus static and how having a dynamic body and having things stay in motion is really good for structure and function. And as a sports medicine practitioner and functional medicine practitioner, I of course think as a bias that providers should focus on the dynamic importance of health. The human body is hard and soft tissue, so that's your bone, and then everything else, muscles, ligaments, tendons, and so forth. And the joints that put all that together are designed to stay in motion. So, where does pain and inflammation come from? Well, here's one thing that if you don't remember anything in this class, there's going to be a few things I don't ever want you to forget for forever. And that's, number one, chronic inflammation is not your friend. Chronic inflammation causes all sorts of problems. In fact, just about every disease and disorder and dysfunction and so forth can be traced back to some sort of inflammatory response. Now, on a quick note, we do have three phases of inflammation. The acute phase, the acute inflammatory phase, which is onset of injury up to about day 3. The subacute phase, day 3, 4, up to about 2 weeks. And then the chronic inflammation, which is 2 weeks and on. For forever. Okay, 2 weeks and on. So chronic inflammation is not your friend. It will hurt you, very devastating. We're going to look at some of that here in a second. Okay, so where does pain and inflammation come from? It comes from macro and micro trauma. And macro trauma is like blunt trauma, like motor vehicle accidents. You got destroyed by a football player in a game. You're skiing, you hit a tree. Horseback riding, it bucks you off, things like that. That's macro trauma. Micro trauma is the repetitive motions like typing, running can even cause it, throwing a baseball, like baseball pitchers, constantly throwing balls over and over again throughout their career. And on you can go with micro trauma. But either way, they can create inflammation and create tissue damage. So ultimately, when a joint experiences abnormal motion, it's going to experience wear and tear. Now this, what we're about to cover, is the bulk of what I do. The patients that come in are experiencing this and typically have been experiencing this for a very long time. So that by the time I see them, it's pretty bad. Okay? So the joint or joints is experiencing abnormal motion, which leads to wear and tear. That wear and tear causes an inflammatory response. The inflammatory response will cause pain because inflammatory mediators come in and the pain fibers are recruited and all that. And this is where most people live. They just live in pain and dysfunction. And because NSAIDs or non-steroidal anti-inflammatory drugs are so readily available in our society, they just take them because it kills the pain. And if that doesn't work, then they get a prescription drug to kill the pain. Okay, fine. So they're doing pain management, still wearing the joint out. Over time it gets worse. At some point the drugs stop working. The chronic pain and inflammation will lead to degenerative factors. So now the joint is starting to degenerate. The degenerative factors will cause loss of function. Now think back to that article we talked about in one of the other slides, Spine Journal 2005. As the spine goes out of alignment and degenerative factors set in and all sorts of other abnormalities, adverse health starts to set in. Pain increases. Now you have nervous system dysfunction and so on. Same idea in your knees, ankles, wrists, shoulders, wherever, any of these joints that are experiencing pain and inflammation, you're going to get degenerative factors and loss of function, which means you're not moving very well. It hurts to run now and walk and get out of a chair and pick up your kids and do whatever. It hurts. That loss of function leads to pathologies, and pathologies lead to decreased quality of life. Here's an example. Motor vehicle accident. Okay, you get hit from behind, whiplash. C5, C6, which is the bones in your neck, the 5th and 6th cervical vertebra, now begin to experience abnormal motion. This abnormal motion, because now they're fixed, they're locked, they're subluxed, that leads to wear and tear. Now keep in mind, a lot of people were probably put in a neck brace, which means static, no movement. Joints deteriorate so quickly if they're immobilized. So the abnormal motion leads to wear and tear. The wear and tear leads to inflammation, chronic pain. The inflammation leads to degenerative factors. Now, since we're talking about the spine, this type of pathology will lead to spinal canal stenosis. That's where the spinal cord itself starts to get choked because the canal that it's in is starting to shrink or stenose, so spinal canal stenosis. And you get radiculopathy, so pain and all that shoots down your arms or your legs. Muscle atrophy, decreased size of muscle because you can't really use it. Thoracic outlet syndrome, or TOS, so the brachial plexus, which is the nerves that come out of the neck that go down your arms into your hands, they're getting infringed upon and messed with. So getting all sorts of problems there, sometimes known as TOS or thoracic outlet syndrome. Can cause headaches, dizziness, vertigo, lead to DJD or degenerative joint disease, or DDD, degenerative disc disease, and so on. There's tons of things that can take place. Now, what should that injured person have done? Immobilize the neck and then do nothing but take pain meds? Maybe. Chase symptoms? Correct the problem? Well, let's find out. Okay, so in this article, it talks about the timing and whiplash. One of my favorite researchers here, Dr. Dan Murphy. And this is from Injury Journal, June 2005. So some of the key points that Dr. Murphy points out from this article is, let's go over here to the highlighted part. So a person's hit from behind, okay, and actually check this out. So right here, 2% had severe problems that required ongoing medical investigations and drugs. That means that 71% of patients had symptoms 7.5 years after being injured. Because typically, the treatments are just pain management, immobilization and pain management. Okay, the symptoms of whiplash injured patient fluctuate widely during a 7.5 year period. It takes 2 years for whiplash symptoms to stabilize. 64% of whiplash injured patients have the same symptom severity at 7.5 years that they had at 3 months. Therefore, most of the patients, meaning 64% of the whiplash injured patients, require intensive management during the first 3 months following injury. That is the key time to get treatments. And I don't mean immobilization and pain management. We're talking your physical therapy, rehab, manipulation, soft tissue work, dry needling, electric stem, all that. All the classic stuff that comes with PT and rehab. If there's any hope of altering this long-term chronicity. Okay, so if they don't get that, then they are completely messed up down the road. 17% of whiplash injured patients will have symptom improvement between 3 months and 7.5 years. And then 19% of whiplash injured patients will have symptom deterioration between 3 months and 7.5 years. Between 3 months and 2 years, symptom fluctuates significantly, and during this time, the estimation of patient prognosis will be unreliable. Okay, let's fast forward here. The cause of this fluctuation is important in the medico-legal reporting since patient outcome can only be predicted at 3 months and not confirmed until 2 years. Okay? Therapeutically, the greatest potential for influencing the natural history of whiplash is within the first 3 months. That's when they need the treatments. And then down here, the study that confirms the assertion that whiplash injured patients should recover in 6 to 12 weeks is absurd if left alone. Okay? Meaning they need treatments, they need the therapies. Okay, there's more information if you want to click those websites on whiplash victims and the best method of care. And really the quick version is you need the PT rehab stuff after injury. The sooner the better. Okay, so here's a lateral, which means a side view x-ray of a person. So here's your, the jaw, teeth, there's your skull, cervical spine. So this is basically showing you what a normal x-ray looks like. Look at the disc height here. Okay, these black spaces, that is the intervertebral disc. The white stuff that you're seeing that almost look like cubes, that's the vertebral bone. Okay, back here, these are the spinous process. So we're looking at a neck here, normal cervical radiograph. Okay, now in this one, I want you to look at the reading left picture. Notice how straight it's looking. Okay, so far the disc height looks okay, but we also have a straight neck. This is sublux, this is out of alignment, this is abnormal position, which means over time abnormal wear and tear. Okay, look at this one. See how this neck or cervical spine has a reverse curve. So if you look closely, it's curving the other way. These are very painful. Typically when I see these patients, nasty headaches, lots of neck pain, trapezius muscles inflamed and on fire. Just, they're miserable, okay? They're tired of taking the pain meds. Typically they take them for years and years, and it's getting worse, and they're tired of it. So they come in, and it's like, wow, look at all this that's going on in your neck. Okay, here's another one. Reverse cervical curve. Here's the skull. There's the jaw. There's atlas all the way down to C7. So you're seeing reverse cervical curve, very painful, very uncomfortable, abnormal, leads to degeneration. Okay, here's a cadaver radiograph on the left, and then there's the actual cadaver on the right. And it's showing you, if you look closely, so look at this degeneration. So there's a disc height. Now look at this. Loss of disc height, loss of disc height. Now if you go over here, what's going on? Look at that nastiness. Look at all that degeneration, pain and inflammation from abnormal motion, abnormal position. Go back to Spine Journal that we looked at. September 2005. What'd they say? When your spine does this, increase pain, increase adverse health. The worse that gets, this right here, the worse this gets, the worse you are. Why? Look at this. Look at this right here. That's your spinal cord. It's being choked. The brain and spinal cord functions everything in your body. When you mess with the spine and the joints and the tissue around it, you're going to mess with the cord. And this is going to decrease your quality of life, decrease immune function, decrease sleep, increase pain, increase pathology, and so on. Okay, so you're seeing the bulges, you're seeing a degeneration, evidence of chronic inflammation and so forth, that it's really hurting that spinal cord. Okay, this one is, summarize it real quick. Basically, we take x-rays to show alignment and degenerative changes. And if function is not restored over time, it's going to get worse. You're going to get all those degenerative factors. The best solution is you got to get on it mechanically, hands-on, with the therapies, with the exercises, with the ergonomics, with the manipulations, the dry needling, all that. That is really good, state-of-the-art conservative management work to get people better and to likely prevent problems from happening down the road. Okay, so we'll talk more about this as we talk about different like down the road we get to muscles and joints and bones and nervous system. We'll really dive into this pretty hardcore. This is kind of giving you a teaser to set up for what's coming.